We continue our conversation now with Dr. Gil Mobley, the physician who showed up at the Atlanta airport in full hazmat gear to protest the CDC, an organization he believes is asleep at the wheel when it comes to handling this Ebola crisis. And Dr. Mobley, I doubt you are alone in that assessment of the CDC at this point.
For a few weeks, it's been a rough go, sir, but now I'm no longer a lone wolf in the woods crying that we have a public health emergency of severe.
And please call me John moving ahead, not sir. I'm not really comfortable with that, but I do appreciate the candor and the respect. Anyway, the CDC is advising possible Ebola patients arriving in the U.S. from West Africa to call a doctor if they feel ill. What is your take on this strategy?
You know, right now in Springfield, Missouri, our Greene County Medical Society is sitting at a table doing protocols and procedures. We're figuring out in pencils and on chalkboards. This should have been done long ago. You know, we should have had policies and procedures in place. We should be doing drills at this point, not trying to figure it out. And that is my public call to action right now to every municipality. Figure this out on your own. We can't wait on the CDC. You have to figure out what you're going to do. And this means think outside the box. When the clusters start to hit, it will immediately overwhelm our emergency system. Already there are nearly 100 people in quarantine around the hospital, the workers in Dallas. What's going to happen when these start happening regularly? It's going to overload the hospitals. We need to think about fever triage centers to get the fevers out of the hospital. One of the basic tenets of emergency medicine is protect the infrastructure. That's why when we arrive to a scene of a shooting, we don't go in unless it's been secured, because we're not going to lose our personnel. The same thing happens if clusters start. We've got to have fevers outside of the hospital and treat Ebola outside the hospital, because if they start, the clusters start, not everybody's going to have respirators. Not everybody's going to have central lines and vasopressive drugs. We'll be lucky to have IVs. We need to think outside the box. The World Health Organization said just yesterday, this is getting out of hand, and we have not planned for the worst case scenario. And John, the worst case scenario is playing out day by day.
So you're saying, doctor, that every community in this country needs to prepare for the actuality of some sort of Ebola outbreak in their community. Others had suggested that there should be regional processing centers, regional emergency centers across the country, but you're saying it's maybe too late for that already.
Absolutely. Do you know how many level 4 containment beds there are in the 4 centers that they're sending a few patients to? 11 in the whole country. And if you think your local hospital, like the CDC was saying just last week, we're prepared locally, if you think they're really prepared, call your local nursing supervisor at the hospital and ask her how many spare negative pressure rooms we have that suck the virus out so it doesn't recirculate. And they will say negative pressure rooms are hard to come by. And even this morning, the Presbyterian Hospital in Dallas is saying, well, we could use the ER, we could use the ICU. Right, that's my point. Close down those essential structures that are already overtaxed. It's not going to work, sir. We are in a dire crisis, and you can't wait on the CDC. You have to figure it out now. Lots of municipalities have spare hospitals around as a result of acquisitions, and if they don't, think MASH units. When the people start coming, we cannot lose the infrastructure. We need to take care of heart attacks, traumas, strokes, OB emergencies. The first rule of medicine is first do no harm and not make a situation worse.
All right, real quick question for you before we part ways here. Yes or no answer. Thomas Frieden, the director of the CDC, should he resign?
He needs help. I don't know that he should resign.
Okay.
I don't know who, you know, there are some pretty good people in Dallas. There's some pretty good people in other states. That's a tough question, sir. He is stepping up to the plate. He needs to become more honest and be truthful that we don't know how this is spread, and that'll decrease the amount of panic that's going on right now. He needs to be truthful. All
right, Dr. Gil Mobley joining Senator Ron Johnson, saying maybe not time for Tom Frieden, the director of the CDC, to step down quite yet, but he does need more help. Thank you very much for your time, Dr. Mobley. More ahead here on America's Forum. We'll be right back after this.